Good evening, everyone. Can you hear me? Hello. Hello. Hello.
Yes, ma'am, you are audible.
Yeah, okay. Thank you. Yeah, ma'am. Thank you very much for the Hindi team. So, very good evening, everyone. Today is our 1993rd day of uninterrupted daily webinar series of IFPH. I invite and welcome all the participants, doctors, students, and the well-wishers of homeopathy to this platform. So, today our guest is Professor Dr. D. Balachandran, MD Pediatrician in Homeopathy, Senior Medical Officer, Homeo, AIMS Patna, former Professor and HOD of Department of Practice of Medicine, RKDF, University, Bhopal. And our topic is today, our very important topic, a comprehensive understanding of EEL serum in homeopathy. So I invite all the participants and especially our chief guest today, our Professor Dr. D. Balachandran, to the platform. So thank you so much, sir. Please. And before that, a silent 1 minute silent prayer. Yes, sir. Now the platform is yours, sir. Please proceed.
Thank you, Doctor, for the brief introduction. Good evening and welcome all for today's topic on a comprehensive understanding of EEL serum. I hope I am audible to everyone.
Sir, it's audible.
If my voice is audible, then I will share my screen.
Audible.
Yes, okay. Thank you for the response. I hope my screen is visible to all.
Yes.
And I hope these slides are moving well. Yeah. It's moving? Yes. Okay, fine. So today's topic is regarding a comprehensive understanding of EEL serum. So why especially I chose this topic is because EEL serum is a remedy in homeopathy, which is being most commonly used as well as abused in this particular period of time. We have a lot of patients with renal failures, acute, chronic, okay, and we are bound to use this EEL serum. Some are using it judiciously in the right way, and some are using it indiscriminately as a universal remedy for every case of renal failure. But whether it really works in all cases of renal failure or whether it is applicable to only those cases whereby its indications are available, we will see in today's topic. As the slide moves on, we'll get to know a bit better. And I will make it as comprehensive as possible. So with today's topic, we will learn something about the eel itself. What is this eel? Okay, what is this creature? Whether it belongs to the amphibians or whether it belongs to the proper fishes. Okay, and there are certain myths and facts regarding EEL serum which I want to clarify to the viewers of today. Because when you see online in YouTube channels and all, there are a lot of people who are just propagating EEL serum like it is a miracle remedy for almost all cases of CKD, which I want to clarify to those viewers. Like, don't fall for this trap. Get to know the symptomatology, get to know the EEL better, get to know the EEL serum better, so that we can able to use it judiciously in our practice. So without much ado, I proceed further. First, we'll learn something about this particular EEL itself. Okay. All right. So there are certain people who are waiting to get admitted. Shall I admit them all? Since I am the host right now. Or is someone going to host it? They can able to admit them. So what should I do? Should I admit everyone or should I wait for the host to admit?
You can admit, sir, because I am not.
You can admit all? Okay, fine, right. Okay, right. I have admitted them. Fine. So regarding the remedy serum angular ethiotoxin. Okay, this serum angular, which is commonly called as the eel serum or serum angular ethiotoxin, it is prepared from a particular species of eel which is called as Anguilla rostrata. Okay, we have the different types of eels present in our ecosystem. But this particular medicine of eel serum or serum angular ethiotoxin is prepared from one particular species of eel, which is called as the Anguilla rostrata, which is known by the common name of American eel. So I have given the picture of how it looks like. So this exactly is how the American eel looks like. Okay, and we have one more species called as Anguilla anguillae, which is an European eel. So we are not preparing medicine from that. We are preparing medicine from the Anguilla rostrata, which is an American eel. Why it's called American eel? Because it's very common in the American countries, in the shores of American countries. Okay, right. So that is the eel serum, the source of preparation. Next, something about the American eel. So it's a ray-finned fish with a long and slender, supple snake-like body. It is covered with mucus, which gives it a slimy appearance. And it has scales like other fishes, but these scales, unlike other fishes, are very minute, which cannot be seen with the naked eye. We have to be closely watching it, or with the magnifying glass, we can able to notice very small scales, but these scales are not generally visible. Uh, and it is covered by a layer of mucus. That is why it is going to give a slimy appearance. Okay. And when you see the posterior part of this particular eel, it is compressed laterally at the posterior end. And when you see the length, the span of this particular Anguilla rostrata, it grows up to a length of 60 centimeters. And it has a whooping weight of around 7.5 kilograms. So this is how exactly the eel looks like. The American eel looks like. The scales are minute and it is embedded in the yellowish brown skin, which gives it a smooth appearance. The color of the eel shows variations ranging from olive green color to brown to a shade of greenish yellow. And sometimes light gray or a white discoloration can be seen on the belly. So for example, the picture what I've shown here, you can see on the belly surface, the color is almost like yellowish or whitish in the belly region. So it has a lot of morphological variations in colors. So it is not having a single color. The color can range from dark color to light color. Okay, right. Now something about the eel in general. Okay, eels from clear waters are often lighter than those from dark tannic acid streams. So in those water resources whereby tannic acid is found in excess, the eels residing in those waters, fresh waters, they appear to be darker in color. Whereas those eels where the water resource is having a low content or almost nil content of tannic acid, the color will be lighter. So I have given you three different colors. You see, one is light colored, and the extreme towards the right is a dark colored one. So that means to say it is a eel which is there in the tannic acid stream. That is why the color is dark. And that is why we have different variations in colors of these eels. Okay. And you should know one thing, that the eel is a catadromous fish. Okay. It belongs to the fish family and it's a catadromous fish. What do you mean by catadromous? Catadromous fishes are those which has their life cycles in two different water streams. It lives most of its lifetime in a fresh water or resource, and then when it is the time of reproduction to lay eggs, which is called as spawning, it goes to the estuary and it goes inside the ocean. It remains there till it lays its eggs, which is called as a spawning period, whereby the fishing has been prohibited for the fishes to thrive. And then after laying the eggs, it again comes back to the fresh waters. So those fishes which maintain this type of life cycle is called as a catadromous fish. And the eel of Anguilla rostrata, or the eels in general, they follow this particular life cycle. That is the catadromous life cycle. So as you can see in the image, it lives in the freshwater streams, okay, like lakes, like rivers, okay, like small ponds. And when it's time for reproduction, from the freshwater through the estuary. Estuary is the part where the river or the particular lake is going to join with the ocean or the sea, whereby their pathway gets widened. That's called an estuary. So in order to get into the ocean, this particular eel has to cross from the freshwater towards the estuary into the ocean area, whereby it is going to lay the eggs, reproduce, and then it reverts back, crossing the estuary again to the freshwater. So this is how their life cycle is. And in the marine or in the sea, when this particular the eggs, when it is going to hatch, the offsprings of this particular eel, these offsprings too even is going to cross from the ocean to the estuary and then into the freshwater. So this is a catadromous life cycle. I hope you understand that the eel is leading two lives, one in the fresh water and one in the marine. In the marine, it is going to just spawn, that is lay eggs, reproduce, and then come back to the fresh waters again. I hope I'm clear with this part, right? Next, moving further. So where do you see this particular Anguilla rostrata or the American eel? So if you see the geographical distribution, this American eel encompasses all accessible fresh water, that is streams and lakes, estuaries, and coastal marine waters. Okay. And their natural range includes the western North Atlantic Ocean coastline from the Venezuela to Greenland, including Iceland. So you can see this red colored part whereby it is given in the shades of red. These are the areas whereby the Anguilla rostrata, the American eel, is very commonly found. And it is one among the endangered species that has to be kept in mind. It is protected by the law of America not to hunt these particular eels. Okay. And this species even extends into the Great Lakes of the Mississippi River and its tributaries as far as upstream as Minnesota and Wisconsin. These are the states of America. Okay, right. Now about the natural habitat, the eels are bottom dwellers. They are called as benthic omnivores. The word benthic means those creatures which reside deep in the base or deep in the floor of the ocean. Okay, so that is called as benthic. And omnivore, you know very well that omnivores are those creatures which are both herbivorous as well as carnivorous. That means they eat plants and as well as they eat insects and small animals. So they are called as omnivores. So here the eels are bottom dwellers. They reside deep in the ocean or else in the lakes or rivers. It is not lying in the superficial layer. It is there in the deep part. Okay, in the base or floor of these particular water streams. They are very shy creatures. They don't come out very easily. They hide in the mud, they hide in the sand or in the gravel very close to the shore at depths of roughly around 5 to 6 feet. So you cannot see an eel very easily with the naked eye. You have to dive inside those areas whereby their habitat is being found with a scuba diver or deep sea diver. And when you go deep, when you further penetrate deep into the ocean or in the water resources, on the depth, you can able to notice these eels. And probably these photos have been taken by deep sea scuba diver, probably. Right. So that's about the natural habitat. It is not visible in the superficial streams. To see an eel lively, you have to go deep into the water. And as I said, the feeding habitat of this particular eel, they are nocturnal predators, means they are a benthic omnivore. That means they can eat both plants as well as animals or insects. And most of their feeding occurs at night. They are nocturnal predators. That should be kept in mind. They are nocturnal predators, means they hunt mostly in night. Okay, so when a particular creature is going to hunt in night, their vision should be very strong. But unfortunately, here, this particular eel does not have a proper eyesight as sharp as that of a owl or other nocturnal creatures. So it is going to rely solely upon the smell. It has a very good sense of smell, just like the snakes. Okay, so it is going to hunt at night, and with the help of the smell as its prime source for hunting the prey, it is going to use the sense of smell to hunt down the prey and eat it. Okay, what do they eat? They feed on small prey animals which can be easily attacked, like small fishes, mollusks, clams, bivalves, crustaceans, insect larvae, surface dwelling insects, worms, frogs, and plants. So these are the foods which they like to eat a lot. Okay, and since these are very shy creatures where they tend to hide in the grooves or gravels or in the burrows, they don't hunt for those prey which are larger than their size. And these are almost very small prey, which is of a very small size. So they easily hunt them. They don't go for bigger mammals to hunt or bigger fishes or sea creatures for hunting. Okay, as they feel threatened that they can be killed in that particular pursuit. Now coming to the active principle from which we prepare the eel serum, that's called as ichthyohemotoxin. So ichthyohemotoxin is the active principle from which we prepare the eel serum. It's a serotoxin. It's a heat labile protein. That means the protein which can be denatured or which can be destroyed by heat. And in certain fishes like the anguilliform eels, they are toxic to mammals. A few drops of fresh eel blood could kill a medium-sized mammal such as a dog. So even a few drops of the fresh eel serum or fresh eel blood could kill a medium-sized mammal such as a dog, including the mammals include humans even, which can create the cramps in the muscles of the heart when taken internally, when it is going to mix in the bloodstream then. Okay, drinking a large amount of fresh eel serums may result in systemic symptoms such as diarrhea, vomiting. These are GIT symptoms, most of them. Diarrhea, vomiting, cyanosis, arrhythmias, paresthesias, paralysis, and respiratory distress. So these belongs to different systems, especially the cardiovascular system and the gastrointestinal system here. And sometimes it can result in death. The oral symptoms from contact with eel serum consist of burning, redness of oral mucosa, and hypersalivation. So if suppose in certain Asian countries like Japan, like China, like Spain, okay, they tend to take the eels even in the raw fresh forms. They cut the eel, they take the blood, they have the tendency to drink the blood, thinking that they have some kind of a stimulant action. They increases the stamina of the body. So for in that pursuit, if suppose someone is going to take the fresh eel serum or fresh eel blood and drink it, when the eel blood, which is fresh, is going to come in contact with the oral mucosa, then it is going to create the symptoms of burning, redness, and hypersalivation. And suppose they are not going to take this intentionally, but due to accidental exposure, suppose there are those who work in hotels who serve the customers with eel delicacies in diet. When they cut the eel or when they come in contact with the blood of the eel, then these symptoms can be produced. These are accidental toxicological exposures. Okay, the toxin is broken down or denatured by cooking. So when you are going to cook the eel in any form, whether when you are going to boil it or when you are going to mash it, when you are going to salt it in a frying pan with the oil, when you are going to cook it for 60 degrees Celsius for 5 minutes, the exposure to gastric juices even in the stomach, a few hours, the eel has dried. These are going to break the toxin. So it is no more toxic when it is being cooked by cooking for 60 degrees Celsius for 5 minutes. And when you're going to take the eel as a food, when it is going to come in contact with the gastric mucosa, with the gastric juices, then that gastric juice acidity is going to kill the particular toxin. So it is safer to take when it is being cooked thoroughly for 60 degrees Celsius for 5 minutes. So if the blood of the eel by chance gets in contact with the eyes locally, it is going to produce symptoms like conjunctivitis, such as intense burning sensation, lacrimation, swollen eyelids, and a foreign body sensation that lasts for days because of the local irritant effects. So consuming eel as food. So eel is considered a highly nutritious diet, which is rich in proteins. It contains about 23 grams of proteins per 100 grams of weight of eel. And it is rich in vitamins like A, E, B1, B2, and omega-3 fatty acids. And it is consumed globally as a delicacy, notably in Japanese, Chinese, and European cuisines as a power food to boost the stamina. So when there is a transition of climate from summer or spring to the winter, so in order to boost the stamina, they used to take this particular eel as food to withstand the extreme temperatures of winter there in these particular countries. And the Japanese unagi or anago means they are the delicacies, food delicacies, which are made from freshwater eel or saltwater eel. So if this particular food is made from freshwater eel, it is called as a unagi. And when it is made from a saltwater eel, that's a marine fish, then it is called anago. So these are the Japanese terms they use for the food where eel is the base for making this food. And next we have the Spanish angulas and European or United Kingdom, that is British jellied eels. So these are used as food in these countries, right? So I given the samples even here how it looks like. Okay, so it is a source of food. Now the main question here. Now I will stop here. If you are going to see the next slide, then you'll know the answer. Now I have a question for the viewers here. How many of you think that the eel from which we prepare the medicine is an electric eel or not? Can anyone unmute yourself and answer me whether the eel from which we prepare the medicine, whether that has the capacity to produce an electric current or not? Or at least how many of you think so that these are electric eels from which we prepare the medicine? Any answers? Or you can even chat. If you are feeling shy to unmute yourself and answer, kindly participate to make the classes interesting for that reason. I won't give much time, just 5 minutes, because I have to complete the slides even. Any of you, do you have any idea? The Anguilla rostrata, the American eel from which we prepare the eel serum in homeopathy, the serum anguilla ichthyotoxin, whether that eel has the capacity to produce electricity or not? Or do you have an opinion that every eel produces electric current? Have you heard about the electric eels? The eels which can produce their own electricity as a defense mechanism to stun the prey when they're going to come and eat it? No idea? I have a chat here. Is there? Okay. Thank you, ma'am. I don't see the answer for it. Fine. Anyway, I will give the answer for you since no one is willing to participate here. This eel from which we prepare the medicine, that is Anguilla rostrata, are true eels. True eels do not produce electricity because they don't have electrocytes, the cells which produce the electricity. We have another category of eels which are called as pseudo eels or false eels. They look like the eel, but they do not belong to the proper category of eels. And those eels which belongs to the species, the genus of Electrophorus, they only do have the capacity to produce electricity. So I want to clarify here that those eel from which we prepare the medicine are not having the capability to produce electricity on their own. Okay. Now the next slide, moving on, we will get to know the difference between those eels. So we have an electric eel on one side and we have the normal eel, which are called as true eels. Okay. The electric eel belongs to the genus of Electrophorus, whereas the normal eel or the true eel belongs to the genus of Anguilliformes. So we have the medicine called serum anguilla ichthyotoxin, from which you can be very able to understand that they belong to the true eel category. The Anguilla rostrata, the Anguilla anguillae, okay, the moray eels, all these belongs to the true eel family. Okay, whereas electric eel belongs to the genus of Electrophorus. The name itself says Electrophorus, means they have the electricity charged in their body. Okay, they belong to the scientific order of gymnotiforms, and they are commonly called as a knife fish. They do not belong to the normal eel. They do not belong to the eel family. They are called as eels falsely because it has the appearance similar to that of an eel, for that reason only. And electric eels, which belongs to the genus of Electrophorus, have certain specialized cells in the body, especially in the tail region. Those cells are called as electrocytes. And these electrocytes can able to produce a high voltage electric current. And it can produce a voltage of about 860 volts. Just imagine, there will be a huge burst of electric current at a time, where only when it is trying to defend itself, not at every time. Okay, that is one difference you should understand here, that the medicine from which we prepare belongs to the anguilliform or the true eel category, whereas there is a separate category again which are belonging to Electrophorus, which are actually called electric eels, from which have the capacity to produce electric current. So our homeopathic medicine, the eel from which we take the medicine, the eel serum, that doesn't have the capacity to produce electric current on its own because they don't have electrocytes. And when you see the breathing pattern, the normal eel or the true eel have gills just like the other fishes. The gills are going to help in the breathing of oxygen which is dissolved in the water. And as I already said, true eels are benthic omnivores. They reside at the very bottom of the particular water resource. They do not come up. So for breathing, there is no other way other than utilizing the oxygen which is dissolved in the water. Whereas the electric eel are those eels which remain on the surface of the water. They do not reside at the bottom. Okay, and they are obligate air breathers. They need oxygen in the atmosphere to breathe. They cannot able to breathe inside the water. Just like the human beings or the other amphibians. Okay, we have a type of fish called as lungfish. The lungfish, unlike other fishes, cannot able to breathe the oxygen dissolved in the water. They have to come up on the surface. They have to respire the air in the atmosphere, just like we do while swimming, and then it goes again inside. So just like that, the Electrophorus species or the electric eels are surface dwellers. They do not reside at the bottom. They remain on the surface. Okay, every few seconds or every few minutes, it is going to come up on the surface of the water with the nostrils provided. it is going to breathe the air just like the human being from the atmosphere, and then again it goes inside. It is not going to go deep because every few seconds again it has to come up. So for that reason, it is going to breathe the air which is present in the atmosphere, not the oxygen dissolved in the water. So this is one major difference. They do not have gills, the electric eel, whereas the true eels have gills and they breathe only the oxygen dissolved in the water. And when you see the habitat, the normal eel or the true eels are found in the marine or salt water, or sometimes fresh water, only because it's a catadromous fish. Whereas electric eels are found in South American fresh water only. So when you see the threat mechanism, electric eel are going to produce electric shocks of about 860 volts because of the presence of electrocytes in the body, especially in the tail region. Whereas in normal eels, they don't have the capacity to produce electric current, so they are going to rely solely upon the sharp teeth with which it is being provided. Okay, so this is one difference regarding the predation. And one major difference again is that the jaw anatomy. The electric eel is going to have only one set of teeth in only one jaw, that is in the mandible. It is not going to have a set of teeth in the maxilla. So maxilla, it is totally devoid of teeth, whereas the mandible, the lower jaw, is going to have sharp teeth, which is very small, okay, like a needle. So that's about the electric eel. Whereas in the normal eel or the true eel, you have to understand there is no defense mechanism of electricity production. So it has to rely upon the jaws. So it has two massive jaws. Remember, it has two massive jaws. So it has on the upper jaw, that's in the maxilla, you have the sharp teeth, which is very strong and which is very sharp and razor sharp, I can say, just like the shark. And in the mandible even. So in both the maxilla and mandible, you have teeth. Apart from that, it has a second set of jaws, which is hidden inside, which is called as a pharyngeal jaw. And this pharyngeal jaws are also having loaded with the teeth to drag the prey inside. And if you viewers have seen a film called Aliens, which is directed by James Cameron, I suppose, there are different parts of it. You can see the alien creature, whereby when it is going to open the mouth, okay, there will be a jaw which is coming outside and drag the prey inside. Okay, so exactly that kind of jaws is present in the true eels. And seeing this, the director got impressed and he has incorporated the same defense mechanism in the alien creature in the film Aliens. Okay, so that is about the pharyngeal jaw. So it has two set of jaws. One is the normal jaw whereby the maxilla and mandible is having the razor sharp teeth. Apart from that, it is having another set of jaw which is called as a pharyngeal jaw, which is hidden inside. And whenever it needs to take the prey inside, it is going to open the jaw, maxilla and mandible, and the pharyngeal jaw is going to come out. Okay, just it is going to pop out. It is going to catch hold of the prey and is going to drag it inside. Whereas in electric eel, if you see the feeding mechanism, since it is having only one set of teeth in the lower jaw, which is very small, it is going to rely upon the suction mechanism. It cannot able to drag the particular prey inside. So what it do is, if suppose it is going to want to eat a prey. So what it does, first it is going to shock it with electric shock. So by shocking it with electric shock, what happens? The prey cannot move. The prey becomes stunned. Okay, it is going to be paralyzed. So once it is paralyzed, it is very easy for feeding. So what it does, it is going to catch hold of the prey with the teeth in the lower jaw, and then it is going to suck it inside just like a vacuum cleaner. And that goes inside and then it is going to digest it. Right? So this is how the feeding mechanisms of a electric eel and a normal eel is. Okay, I hope I'm clear with this topic. It needs a bit of explanation, so I have done. So here is how the electric eel and a true eel looks like. So on the right hand side, you can see the moray eel, which belongs to the true eel category of anguilliforms. And beneath you have the American eel, that's the Anguilla rostrata. That's our topic of study. So this is how they look like, which have two sets of jaws. Whereas on the left side, you can see the electric eel exact. They belong to the family of Electrophorus. We have the Electrophorus volti, which can produce about 860 volts of current. We have the Electrophorus electricus, which produces about 480 volts of current. And we have Electrophorus veri, which produces about 572 volts of electric current. So in the tail region, you can see the electrocytes, which can able to produce electricity. So these three belong to the electric eels, whereas these two belong to the true eels or the anguilliform eels. So they are Electrophorus genus, and these are anguilliform genus. So I hope I made my point very clear. that our medicine is prepared from this American eel or the Anguilla rostrata. They do not possess electrocytes and they do not produce electricity. That much I am clear. Now, you can see this is the skeleton of a moray eel, which belongs to the true eels of anguilliforms. You can see two set of jaws. See here, you have the mandible, which is, having very sharp, razor sharp teeth. And on the maxilla even, you have again razor sharp teeth. This is one set of jaws. And you can see the second set which is hidden inside. This is a pharyngeal jaw, the second set of jaws. So this have been separated. See, this is the normal jaw whereby the maxillary mandible is having a razor sharp teeth, and this is a pharyngeal jaw. This is hidden inside. You see, it does not come out. Only when it is going to take the prey inside, when it is going to open the mouth, then this particular pharyngeal jaw comes out, pops out. It is going to catch hold of the prey and it is going to grab it and inside, pull it inside. So this is a moray eel skeleton, an example whereby you have two set of jaws. I hope I'm clear. And when you take the same skeleton, if you are going to see the electric eel, only the mandible will be having the teeth, and not this razor sharp and not this much long. It will be very short, like a needle. Okay, and it won't be this much stubborn even. And the maxilla does not have any teeth only. So this is how with the skeleton you can able to identify, or when you're going to catch hold of a fish, of an eel, you should differentiate what species are you holding. So with this you can able to understand whether this is a anguilliform eel or an electrophorus eel, right? Now coming to the homeopathic aspect. So I am done with the creature, the eel. Broadly now you know how to differentiate what is an eel and from which medicine, from which eel are we preparing the medicine. What are the characteristics of that particular eel? What is the difference between an electric eel and a normal eel? What are the feeding patterns, where they are being present or distributed, where they lie, and how to differentiate between them, right? Now, coming to the homeopathic preparation, the eel serum from which we prepare the medicine is a yellowish to greenish yellow opalescent liquid, just like the human serum. Okay, but human serum is a bit transparent, but here is it's translucent or pale. It may be pink due to slight hemolysis. Its preparation involves a careful process of identification of the species. First, you have to be sure with a herpetologist or probably a marine scientist or marine doctor to be very sure that whether the species what we are catching hold of in the deep water resources, whether actually are we going to catch the American eel or is it some other species, since it has a lot of variations in the species. So first we have to identify whether we are catching hold of a American eel or whether we are catching hold of a European eel or some other eel species. So first you have to identify the species, then you have to collect the blood, okay, and you have to separate the serum. This process should be going on very fast. You don't delay, okay. You have to separate the serum and you have to immediately attenuate up to the 3x dilution, okay, with the isotonic sodium chloride solution. Because why we have to immediately do this particular potentization till 3x? Because below 3x, the medicine is of no use. The particular raw material from which we prepare the medicine will be having no active principle or will be denatured. Okay, so it is very important that you identify the species, collect the blood, separate the serum, and attenuate immediately with the isotonic sodium chloride solution till 3x. And after 3x, you can able to store it very safely. Below 3x, it cannot be stored. So very difficult to bring this potency up. Okay, that's why it's a bit costlier than the other medicines. I hope so. Right. Special arrangements are being made for collection, preparation, and transportation of the remedy. Okay, so this is the homeopathic preparation. Now, who introduced this particular eel serum in homeopathy? The credit goes to two doctors, the most prime among whom is Dr. Pierre Jocha. Okay, the pathogenesis of eel serum was studied by Dr. Pierre Jocha, who belongs to France. He is a homeopath. He was 90 years old when he tried to study the remedy or the medicine, and he used his rudimentary methods in the hospital Saint Jacques in Paris. Okay, and we have one more doctor who is late Dr. Picard, who belonged to the same hospital, and he has also done some remarkable studies in the Congress of Budapest in 1935. He presented an extremely interesting report of this remedy. He said that the serum of eel in 3x is an excellent remedy for acute nephritis, together with phosphorus, arsenic, mercurius, cantharis, and apis. especially in case of massive albuminuria and chronic hypertensive nephritis. So in these two conditions, acute nephritis, okay, with massive albuminuria and chronic hypertensive nephritis, in these two cases, it is an excellent medicine in 3x potency, and it can be thought of along with differentiation from the medicines like phosphorus, arsenic, mercurius, cantharis, and apis. And Dr. Picard was a fellow or a colleague homeopath with Dr. Pierre Jocha in the same Hospital Saint Jacques in Paris. Okay, you can see his name in Borix Materia Medica. It has been given, Dr. Jochet, Pierre Jochet has said in brackets, in some of the lines it is given Jochet. Okay, and he is the one who Dr. Boric is being referring to, right? Now, you know very well that homeopathic materia medica has its sources from various other things. We have the resources from the healthy human drug proving, the sources from which we get the symptoms in materia medica, from the healthy human drug proving, from toxicological findings, from clinical observations, and then by clinical verifications, and then by accidental proving. So these are the almost like resources from which we get the symptoms. So what I would like to add here is the pathogenesis of serum anguillae, which is given in Borix Materia Medica, is mainly based on toxicological poisoning. Why I am saying this, I am giving you the reasons why. You remember the toxicological symptoms I said about the ichthyohemotoxin? What are the symptoms? One of the symptoms is paralysis, for which we can able to find the corresponding rubric in the repertory. We have extremities bent position, inwards, fingers and toes, extremities formication, crawling kind of sensation, extremities awkwardness, drops things. So these symptoms is going to justify the toxicological symptom produced by the EEL serum of paralysis. And second, I said, if suppose someone is going to take the raw eel or going to drink the blood of the eel freshly, it is going to produce a burning sensation in the mouth as a local irritation. You have the corresponding symptom, mouth pain, burning, smarting. And when it is going to fall upon the surface of the body, it is going to create a sensation of paresthesia, whereby you have the corresponding rubric here, skin formication, crawling. And I told you, when it is going to have a systemic manifestation of toxicological symptom, it is going to act upon the heart and produces cramps on the heart. And you have the corresponding symptom here. Heart and circulation, we have in the section, pulse, heartbeat irregular, which is an arrhythmia. And then we have the ocular symptoms, means the symptoms belonging to the eyes, like a local irritation and all. Now here we have the rubric, eyes desire close to because of irritation, itching of the eyes and heaviness of the lids because of the swelling which is there in the upper eyelids. Okay, edema. And we have the respiratory distress, the symptoms belonging to the respiratory system. And we have the corresponding rubric here, respiration difficult, sudden paroxysm. So this justifies, or with this evidence, I can able to say that the proving of serum angular ichthyotoxin in homeopathy introduced by Dr. Jocha is mainly from toxicological proving rather than the healthy human drug proving. And along with that, there has been symptoms added after clinical verification upon testing upon the patients clinically. Right? So I am clear with this part. Next, we'll proceed further. Now, these are the gist from Borix Materia Medica. If you see the Borix Materia Medica, you don't find the head-to-foot symptomatology, but you find a very big paragraph which describes serum angular ichthyotoxin completely. And I would say here that there is no Materia Medica other than Dr. Boric which has given a detailed picture of serum angular ichthyotoxin. You take the classic books, you take Clark's Materia Medica, you cannot find it. You take the Allen's Encyclopedia, you cannot find it. You take the Allen's Keynotes, no. Okay. You take what else book here? You take Kent's Materia Medica, you don't have it. You take Boger, you don't have it. But you have one in Borix Materia Medica, and second, we have the collection of all the works put together. That's the Robin Murphy's Clinical Dictionary, where you have the head-to-foot symptomatology of serum angular ichthyotoxin. So here, this I have compiled from taking into account from Boric, because he is the one who has taken these findings from Dr. Jocha and late Dr. Picard and has put into his Materia Medica for the very first time. Right. So in Borix Materia Medica, if you see, he says that the toxicological effect of EEL serum is found in the body primarily in two areas of the body. That is in the blood, and second is in the kidneys. So it has a toxicological effect upon the blood. On the blood, it is going to cause the toxicological action. That is, it rapidly destroys the globules. And what are there in the globules of the blood? We have the immunoglobulins. They are the gamma globulins. We have the RBCs or the red blood cells which contain the hemoglobin, and we have the plasma proteins which are the serum albumin, serum globulin, fibrinogen, prothrombin, among which fibrinogen prothrombin is helpful for clotting of the blood. Okay, and albumin and globulin are transport or carrier proteins, right? So it destroys the globules. That means it is going to destroy all the three things. Okay, it is going to destroy the RBCs or the hemoglobin. It is going to destroy the immunoglobulins or the gamma globulins. And third, it is going to destroy the plasma proteins, whereby the blood clot cannot happen or the carrier proteins are being disturbed here. So when immunoglobulins, that is gamma globulins, are going to get destroyed, then what happens? The person's immunity wanes away because they are going to help in immunity. And when the immunity wanes away, what happens? The person can get infection very easily. And when RBCs are broken down, what happens? The hemoglobin level falls. And when hemoglobin levels falls, you get anemic. And where does the hemoglobin go? It is going to get excreted from the body by the urine. And that is why you have the hemoglobinuria here. Right. Next, coming to the kidneys. In the kidneys, it is going to cause albumin and renal elements which are called as cash in modern pathology in the urine. And we have the hemoglobinuria and we have the prolonged anuria. Anuria means what? Absence of urination, or we can say the urine output almost less than 100 ml per 24 hours. That is called as anuria. And when you say oliguria, oliguria is urine output for 24 hours less than 400 to 500 ml. So these are the definitions medically for anuria and oliguria. And these are the symptoms of renal failure. So if any person is going to have a prolonged anuria of almost lasting 24 to 26 hours, then we can think about this particular medicine. And he also says that primarily blood and kidneys are getting affected by the toxicological action. The secondary effects are being found in the liver and heart. And on the liver and heart, you are going to find alterations as those observed in the infectious diseases. So this is the gist of the introduction about serum angular ichthyotoxin in Borix metremedica. Now, I'm going to give you the therapeutic indications according to Borix metremedica. Right. So here, the first and most important action or therapeutic indication of serum angular, you have to focus here. I'm asking every viewer to focus here. Right. So the first action or the first therapeutic indication that Boric gives is in the case of renal failure. That is in the acute renal failure especially. So when the kidney is going to get affected by any acute infections, and here the word being used is acute nephritis a frigori. Joshua has used the word, just imagine. Okay, they are also called subacute nephritis. And why the kidney is getting affected acutely? Due to the exciting causes. And what are these causes? That is ailments from exposure to cold, exposure to any infection, and intoxication. So remember these three words: ailments from cold, infection, intoxication, because of which the kidney is going to get acutely affected. Then, due to which there is going to be the renal failure happening, acute renal failure. The symptoms being, or you cannot say the symptoms, but the signs being that there is a lot of albumin being leaked in the urine and the urine output is not happening. There is anuria or oliguria. In that case, we can think about serum angular ichthyotoxin. And what I want to clarify here is the word acute nephritis a frigori. It's an old terminology, just like phthisis. You don't find phthisis now. Phthisis is the word being used instead. Now we use the word tuberculosis. And we have scrofullosis, which is the old terminology. We don't use the term now. Scrofullosis is now being called as cervical lymphadenopathy. Okay. Likewise, here we have a word called medical terms, which is being given at the time of Dr. Boric and Dr. Joshua, which is the acute nephritis a frigori. That means acute inflammation of the kidney, which is believed to be caused by sudden intense exposure to cold. When we convert this into modern medicine language, that translates to acute post-streptococcal glomerulonephritis. Because what happens when you go into exposed to cold, you get the symptoms of pharyngitis or laryngitis. You have the throat irritation, you have the acute tonsillitis, okay, you have the pharyngitis, you have the pain in the throat, together with the nasal upper respiratory symptoms. So, whereby if you correlate to the modern medicine, the most common organism being the streptococcus, beta hemolytic streptococcus. Okay, so when due to acute exposure to cold or the exposure to post-streptococcal infection, when the kidney is going to get affected because of this particular bacteremia, because of the toxins produced by this particular bacteria, and that is given the name acute post-streptococcal glomerulonephritis. In that case, this medicine is of par excellence. So what happens when you're going to give serum angular? So it is going to arrest the albuminuria, okay, and it is going to reestablish a diuresis, whereby the acute renal failure has been taken care of. Okay, so Dr. Joshua says here in Boris Medical is given in the presence of acute nephritis a priori with threatening uremia. That means when the kidney is about to fail, we should always think of this remedy. So this is one therapeutic indication. Don't ever forget in life. So this is for the renal failure and especially for acute renal failure or ARF, right? Now, next coming to the next one, second therapeutic indication. So when you have a patient who is having a heart disease, who is diagnosed as a case of heart disease, organic heart disease, and when during the course of a heart disease, his kidney, which was previously working well, is going to suddenly shut down or it's going to suddenly stop functioning due to a pre-existing heart disease, then you think of this remedy. So he says here, when during the course of the heart disease, the kidneys, which was previously working well, should suddenly become affected and its function inhibited, you should think of serum angular ethiotoxin. And what we get out of it, because of the renal shutdown, you get again the same albuminuria, that is albumin leakage in the urine, okay, proteinuria, and you have the anuria and oliguria. And these are given the terminology of cardiac uremia. That means uremia is a condition relating to the kidneys and cardiac is an underlying heart disease. So because of a heart disease organic, when the kidney is getting shut down, you get a condition whereby which is called as a cardiac uremia. So in this case, if you're going to give the EEL serum, it is going to rapidly arrest the albuminuria and it is going to reestablish the diuresis. So Dr. Bori gives here a word very clearly that there where digitalis is powerless. Digitalis is a heart remedy. Remember, it's a primary heart remedy. So in those conditions of heart diseases, whereby the kidneys are getting affected due to an organic heart disease and it is causing a cardiac uremia, in those cases, there where digitalis is powerless, the serum of EEL has put an end to the renal obstruction and produced an abundant diuresis. So he has diuresis. That means urine output has beginning to happen. Anuria and oliguria vanished away. The patient is going to normally function and the urine is going to get normally secreted. See, this is the lines of Dr. Burik. And remember, these words are not simply put as such. It is being tested, time tested, and then these have been included in the Materia Medica. If you read the Borik's Materia Medica, the introduction, he will say that each and every symptom has been clinically verified and carefully put in my Materia Medicas. Right? So that's a second indication. Third indication. Now, forget about the kidney part. Come to the heart alone. Serum angular ethiotoxin or EEL serum can also be given in heart diseases, provided it is going to satisfy the criteria. Now, what are the criteria? You have a functional heart disease, not an organic one. Remember, if you have an organic heart disease, then you think about cratagus, you think about digitalis, okay? You think about terminalia arjuna, or you think about adonis vernalis. So all this comes into view. But if you have, you think about strophanthus, likewise. But if you have a heart disease whereby the heart disease is a functional one, for example, you have the left ventricular diastolic dysfunction, whereby the left ventricular ejection fraction is reduced about 50%, say 55%. And the patient has symptoms like palpitations, angina, arrhythmia, fatigue, which are common symptoms of this particular left ventricular diastolic dysfunction. In those cases, you can think about EEL serum. And second indication, if there is a failure of compensation. Compensation can mean, what is the meaning of compensation? Means the heart is failing and there is a hypertrophy which is going to happen to compensate the heart action. If that is not happening, if there is a failure of compensation, and if there is an impending asystole. Impending asystole means the heart is tending towards an arrest. Okay, asystole means the heart is not beating only. Okay, it is not exactly asystole, it is impending, means threatening. The heart is threatening towards asystole, which is called as a cardiac arrest. So in these conditions, you can think about serum angular ethiotoxin. And what will be the indications here? So these are the conditions whereby you can give the EEL serum and the symptoms. You cannot say symptoms, but instead you can say these are the findings. You get a asystolia, means the heart beats are very feeble or it is sometimes stopping in between. So asystolia with or without edema. You have a heart cardiac arrest or functional heart disease with or without edema, then you can think about. But what I would generally say, if you have an asystolia without edema, this medicine is very strongly indicated rather than with edema. Okay, and then you have mitral insufficiency, you have dyspnea, valvular deformities, and due to which you have dyspnea, which is again a cardiac uremia, together with if you have some of the symptoms of the kidney, such as anuria and oliguria, then it is going to be very efficacious for the heart and it is going to reestablish the diuresis. Again, the same things what Dr. Borik says. Where the digitalis is powerless, the serum of EEL has put an end to the renal obstruction, producing abundant diuresis. So that's about the therapeutic indications of serum anguillae. Now, we have to differentiate the closely running remedy, that's the digitalis with the EEL serum. So you have the popular triad, which is again given in Dr. Borik's Materia Medica. In digitalis, you have the triad of 3 symptoms: edema, arterial hypertension, and oliguria. Whereas in EEL serum, you don't have edema. You have arterial hypertension, you have oliguria. Arterial hypertension indicates a functional heart disease, and oliguria is, I said, that due to a heart disease, if suppose the kidney is getting affected, the second indication for application of serum anguillae. So you have this particular indication here. So you don't have edema, absence of edema, together with arterial hypertension and oliguria. Now it is surprising, when a person is going to have a proteinuria, that is albumin leakage in the urine, that tends to be the edema, which is happening in the legs as well as the face, puffiness in the face, the dependent edema upon the legs, or in the sacral region when the patient is in an ambulatory phase. Whereas in EEL serum, you don't find that. So it is an uncommon peculiar symptom. You have a renal failure, but you don't find edema, right? So that is one of the PQRS here. Next, in digitalis, you have the organic disease of the heart, such as cardiac muscle failure with asystole. Whereas in EEL serum, you have the functional heart diseases, such as arrhythmia, angina, fatigue, and palpitation, left ventricular diastolic dysfunction, impending cardiac failure, or impending cardiac arrest, kind of. And you have one more symptom that here in digitalis, which is a primary heart remedy, the heart is primarily involved with abnormally slow, weak, irregular, intermittent pulse and dropsy. Here, dropsy is there. That's why we have the edema. Okay. Whereas in EEL serum, here the primary involvement is in the kidneys. That's why the first indication is on the kidneys only. Kidneys are primarily involved with the presence of albumin, renal elements in urine, hemoglobinuria, and prolonged anuria. So this is how you differentiate EEL serum from digitalis. And then we have a scientific review of EEL serum in renal dysfunction, which are done by Dr. R. Vallavan and his colleagues from Schwabe, India. And it is published in the Journal of Evidence-Based Homeopathy in 2023, whereby he has given 4 of his findings in the research. In many patients with chronic renal failure, serum anguillae has maintained well the renal profiles without the need for hemodialysis. That is one finding. Second is, in patients with chronic renal failure already on long-term hemodialysis, the number of dialysis needed over a period of time was markedly reduced after giving serum anguillae. The remedy has been found to allow smoother reversion to normal in patients undergoing hemodialysis, and in a double-blind plasma-controlled randomized control trial, serum anguillae is among the 6th commonly used medicine in the treatment of pruritus, that is itching, in hemodialysis patients. So that's about the scientific evidence-based journal which supports the EEL serum in renal failures. Now, when you see some of the mind rubrics here of the prominent mind rubrics in serum anguillae, you can say here, cannot able to handle things anymore, overwhelmed by stress. He gets stressed a lot. Next is company aversion to desire for solitude. As I see, it's a doctrine of signature. The eel, I told you, it doesn't live in groups. It lives in isolation. And it lives at the bottom of the water resources, hiding itself. Okay. Despair from weariness. Discontented with work. Discouraged easily. All pessimistic attitudes. Excitement, excitable from music. Fight wants to. Hide oneself, desire to. See, again, the eel, I told you, it's a shy creature. It is going to hide itself in the gravels or sand in the mud beneath the water resources. Likewise, the person himself has the same doctrine of signature. He wants to hide himself, oneself, desire to. Indifference, apathy about business. Indifference, apathy about anything. Intolerance, aversion to work, does not want to work at all. Irritability with sadness. Irritability about work. Jesting makes puns. Kicks in tantrum. Pessimistic attitude. And next is postponing everything to the next day because he is a lazy creature. Okay, so this is the prominent mind symptoms. So you have a patient who gets stressed a lot, who wants to live in isolation, does not mingle with anyone, okay, who has a lot of negative thoughts in the mind, who is discontent with work, who has an indifference or apathy towards everything, or especially work, and wants to postpone things to the next day, then you can think about this medicine together with the indications proper given in book. Right, and it has a lot of dreams. Some of the dreams are amorous, dreams of snakes, dreams of black with yellow design snakes, storms, vivid, water, flood. It has many dreams, journey from traveling, exciting, and black animals. And since my time is almost up, I will conclude here. These are the head-to-foot symptomatology given in Dr. Robin Murphy's Clinical Mathematics. You can have a look. And these are some of the clinical rubrics just given in the kidney section. Again, you can have a look. And this is given in the urine section in the repertories. Thank you so much for giving this opportunity. I will stop my screen sharing. If you have any doubts, you can ask me.
Thank you so much, sir. It was a very good session. It's a great day with you, sir. So you given us a very vast explanation of the EEL serum, EEL, both the pseudo and the original one. Thank you so much. I think first time I am hearing all these things actually. So thank you so much for your description, sir. So if anyone have any queries, you can ask sir directly, or you can chat, you can message in the chat box.
I think Dr. Hariharan is raising the hands. Suppose he's having any doubt.
Sir, Hariharan sir, you can ask the question, sir.
Can he able to unmute himself? I suppose.
1 second, sir.
Yeah.
Sir,
Yes.
Very nice class. Congratulations. Sir, my question is that which potency is more effective in cardiac cases as well as kidney cases? Which potency is more effective?
If you ask my personal experience, I would say that kindly maintain with the low potencies like 3x or 6x, because these are conditions whereby some of the organic changes have already happened. So if you are going to give the high potency, then I think probably the vitality will not be there to produce the secondary curative action regarding this. So it's better to maintain in the low potency. And again, there may be difference of opinion, because potency is such a subject whereby the experience is derived by each and everyone's practice. So as far as my practice is concerned, I would request you to kindly maintain with the low potencies. And even the famous companies like Dr. Riekweg and Dr. Wilmer Schwabe, Germany, are recommending the low potencies. The study what I have given by Dr. Balavan, he even uses 3x potency of Dr. Wilmer Schwabe, Germany.
Thank you, sir. 7x potency is available in Schwabe, I think.
I think you can use it. Yeah, that's what I say. These are low potencies. You can use this.
Okay, sir. Thank you very much. Very nice class. Okay, congratulations.
Thank you. Anyone else? Any doubts?
I think
one quick question to everyone. Can anyone unmute yourself and say me whether EEL serum is indicated in diabetic nephropathy or not? Those who have an idea, or those who have treated patients in their clinic, just unmute yourself or just put it in the chat box whether that is indicated in diabetic nephropathy, which we commonly face nowadays as a complication of diabetes. No one has treated a case of diabetic nephropathy with EEL serum. Good. Okay, fine. You'll get cases. Kindly share the response when you give this medicine. And kindly remember Borix therapeutics. I mean the Borix indication for diabetic nephropathy. Because I told you it's for the acute infections of the kidneys. Acute infections, there is glomerulonephritis, post-streptococcal, and you have the acute renal failure. Diabetic nephropathy is a chronic one. It's not an acute one. So remember that part, and then you decide upon whether that has to be really given in the patients or not. And one myth I want to break here is that there is, I'm sorry I'm using this particular name, there is a homeopathy, which is, you can find this in the YouTube. They are saying that the EEL serum has the electric discharge of the EEL, and when a person is going to take the EEL serum, they have some CKD drops, I suppose, whereby EEL serum is a part of the formulation. They claim that this particular EEL serum, which is there in the CKD drops, have the electric discharges from the EEL, and when you're going to take the CKD drops, this electricity is going to go and affect the kidneys, and the kidney gets all right. Bakwas, humbug, total humbug. I told you very clearly, this particular EEL serum is not prepared from the electric eel. So this is a myth. Just go to YouTube and see, and then you will get to know. I want my viewers to be very clear what are the indications and whether you are the stress busters, and you should know where things go wrong and you should correct them. they don't know anything. And there will be many people who see this particular video of YouTube and they will remember that, yes, it is prepared from electrical, but it is not. For that reason, this particular comprehensive understanding of EEL is essential. Yes, thank you. This is what I want to ask my viewers to see. No, I don't think so. Dr. Abraham Vaidyan, EEL serum is not useful in diabetic retinopathy. There are no indications for it. No? You have only the symptoms of conjunctivitis, that's all. And diabetic retinopathy is not going to have any symptoms of conjunctivitis as such. You have the blurring of vision, you have the woolly exudate, due to which the vision is being disturbed, that's all. Thank you, Dr. Abraham Vaidyan, for raising up this question. No, it is not useful in diabetic retinopathy. Yeah.
Oh, thank you so much, sir. It is a wonderful session today. So we are requesting again, please come again and you give us a valuable advices about a new subject. So,
thank you. I will definitely do.
Okay, sir.
Thank you.
So I think now the time is over. For now we are moving to the Malayalam section.